Well, I think it's something we need to start talking about amongst each other, and that framing it as an injury is often less stigmatizing. And I've even said to some of the younger students that I mentor now, I say, you know, you don't go to the gym when you're injured. You go to the gym to get healthy. I said, so why would you expect that you can totally neglect your mind and be healthy? I said, you know, going to see a counselor, talking about the stuff inside, it's like exercise for your mind. And it's not that weak people need to do it, rather that if you want to be smart, you want to get ahead in life, you're going to strengthen your mind, and you're going to, you know, get the experts. You know, they're giving you help for sure, but what you're doing is you're taking advantage of their expertise, their years in training in this. So do it to get ahead in your life.
My advice for men who are facing depression would be not to do it alone. I know it's tough. Guys are expected to be tough, and you're expected to tough it out and do what you got to do. But really, it's a lot easier to do those masculine roles and to fulfill those roles that you have to fulfill if you're not depressed. And there are ways to not be depressed. There's lots of resources out there. And my advice to anybody in that kind of situation would be the first place to go would be the family doctor. They don't have the training to get really deep into it, but they can at least start the process, figure out whether you need a psychiatrist or a psychologist or some other kind of therapist, or whether you need medication. They can sort of start getting you into the right kind of treatment and the right kind of help.
My only advice is get help. There is help out there. I know that it's limited. I know that it takes a long time to get get an appointment with a shrink, but do it. Hang in there. Try and get to the point where you can get help. Even get to something like the Canadian Mental Health Association or the local, in our case, Delta Mental Health. Look at the literature. Recognize the symptoms as they apply to you. Recognize that you're ill, and try to educate yourself about what depression is all about.
And tell yourself and motivate yourself to get help. Don't just, I know you've heard this a million times, and I know we've heard it a million times, but there's some truth in it. Get connected with people and stay connected with people. Even when they're the last thing you want to do. It's very, very vital.